For men, the scariest thing is getting tested and finding out you have no sperm. It happens a lot. Every day I'm here, I run tests for these guys, and every day there are 3 or 4 cases with no sperm at all. And when there's no sperm, I just feel so worried and stressed out, it gives me a headache. As you know, there are many reasons that can cause you to have no sperm, but if you have no sperm, then it's 100% certain that you can't conceive naturally. Even now with in vitro fertilization, it's the same. You still need to have at least a few sperm. To create an embryo, you need to inject the sperm into an egg to make the embryo. But if there's no sperm, then what can you use? So in almost all cases where there's no sperm, the first thing I do is order a full set of tests. We look for the causes because there are some causes where even after surgery, there's still no sperm, meaning the body doesn't produce sperm at all. For example, Klinefelter syndrome, which means having the 47XXY chromosome set. People born with Klinefelter almost never have any sperm. If the test results show Klinefelter syndrome, then there's no point in having surgery. Why operate when there's no sperm? In that case, you'll have to use donor sperm. For cases where the tests show that surgery is possible, the next step is that you just have to go through with the surgery. There's really no other way. So how is the surgery done? There are 2 methods. One is that they just need to extract it. They use a needle to extract from the epididymis, and if there's sperm, then it's the simplest. Just do ICSI right away. That's the easiest. Extract the sperm and proceed immediately. Those cases are usually when the vas deferens is blocked, meaning sperm is still being produced inside but can't get out. Since the passage is blocked, we just extract it from inside, which makes it easy to collect for IVF, and pregnancy can be achieved simply. In cases where extracting doesn't yield any sperm at all, the next step is to actually cut open the testicle. We make an incision in the covering, then cut into the testicle itself. Our testicle is round like a marble. Then, after making the incision, we cut out a piece of tissue from inside. That tissue contains the seminiferous tubules. We then examine it under a microscope to see if there are any sperm. If there are sperm, we collect them to freeze or immediately inject them into the egg to create an embryo. After the surgery, we simply stitch it back up. In cases where surgery doesn't yield any sperm, there's another method called microtest. This means they perform a deeper surgery, but this time under a microscope. The chances of success are still low, but if sperm are found during the procedure, they can be retrieved and used, though the success rate isn't high. It's really tough, guys. Just hearing about men who have no sperm, I can tell it's a serious issue, a really big deal.